Welcome to our channel. Today, we're diving into the history of the most dangerous pandemics that have shaped our world. From the Black Death to COVID-19, infectious diseases have left an indelible mark on humanity. Throughout the centuries, pandemics have brought societies to their knees, reshaping the course of history. They've tested our resilience, challenged our understanding of the natural world, and reminded us of our interconnectedness. Join me as we embark on a journey through time, exploring the stories of these outbreaks and their profound impact on civilization. Our story begins in the mid-14th century, when the world faced an invisible enemy of unimaginable ferocity. The Black Death emerged from Central Asia, traveling silently along trade routes, carried by fleas on rodents. It reached Europe in the 1340s, carried by merchant ships. Imagine the bustling port cities of Italy, unsuspecting of the horror they were about to face. Within months, the plague swept across the continent. Medieval medicine could offer little resistance. Fear and superstition gripped the land. The Black Death spared no one, striking down rich and poor alike. It wiped out a third of Europe's population. Entire villages were decimated, fields left untended. The world changed forever. The Black Death had a profound impact on history. It led to labor shortages, empowering the peasant class. It spurred advances in medicine and public health. As the world reeled from the First World War, a new and invisible enemy emerged. The Spanish flu, a deadly strain of influenza, swept across the globe in 1918, leaving a trail of devastation in its wake. Unlike the Black Death, which primarily affected the old and infirm, the Spanish flu struck down healthy young adults with terrifying speed. Imagine soldiers, already weakened by war, crammed into trenches, only to fall victim to this new and silent killer. The virus spread rapidly, facilitated by troop movements and global travel. Soon it reached every corner of the world, from the bustling cities of North America to the remote villages of the Amazon. Hospitals overflowed with the sick, and morgues could not keep up with the dead. The world watched in horror as the death toll mounted, reaching an estimated 50 million people worldwide. The Spanish flu pandemic exposed the vulnerabilities of a globalized world, where an infectious disease could spread with alarming speed. In the aftermath of the pandemic, there was a renewed focus on public health measures, such as sanitation and hygiene. The development of vaccines, though still in its infancy, offered a glimmer of hope for the future. The Spanish flu, though a stark reminder of the fragility of life, also spurred advancements in medical science. HIV/AIDS, a modern pandemic. In the 1980s, a new and perplexing illness emerged, initially shrouded in fear and misunderstanding. The HIV/AIDS pandemic, first recognized in the United States, quickly spread across the globe, challenging long-held beliefs and testing the limits of scientific knowledge. Unlike previous pandemics, which often ran their course and subsided, HIV/AIDS became a persistent global health crisis. The virus, transmitted through bodily fluids, primarily affected marginalized communities, including gay men and intravenous drug users. Stigma and discrimination hampered efforts to control the spread of the disease. However, amidst the tragedy, there were stories of resilience, compassion, and scientific breakthroughs. Activists and healthcare workers tirelessly fought for access to treatment and challenged societal prejudices. Scientists raced against time to understand the virus and develop life-saving medications. Over time, antiretroviral drugs emerged, transforming HIV/AIDS from a death sentence into a manageable chronic condition. The global community came together, establishing organizations like UNAIDS to coordinate the response and provide support to affected countries. The HIV/AIDS pandemic, though far from over, serves as a powerful reminder of the importance of scientific research, public health infrastructure, and social justice in addressing global health challenges. H1N1 influenza, a pandemic in the age of information. In the spring of 2009, a new strain of influenza, H1N1, emerged in Mexico, quickly spreading across the globe. The 2009 H1N1 pandemic, also known as swine flu, highlighted the interconnectedness of our world in the age of globalization and instant communication. Within weeks, cases were reported on every continent. The World Health Organization declared a pandemic, and governments scrambled to implement public health measures, including travel restrictions and school closures. The media played a crucial role in disseminating information, sometimes fueling fear and uncertainty. Fortunately, the 2009 H1N1 pandemic, though widespread, proved to be less severe than initially feared. Existing antiviral medications were effective in treating the virus, and a vaccine was developed and distributed globally. The pandemic served as a reminder of the importance of preparedness and international collaboration in responding to emerging infectious diseases. COVID-19, a pandemic for our times. In late 2019, a novel coronavirus emerged in Wuhan, China, rapidly evolving into a global pandemic that would test the limits of our healthcare systems, economies, and social fabric. The COVID-19 pandemic, unlike anything we've seen in recent history, has brought the world to a standstill. The virus, highly contagious and capable of causing severe respiratory illness, spread with alarming speed, facilitated by global travel and interconnectedness. Countries implemented lockdowns, travel restrictions, and social distancing measures in an attempt to slow the spread. Healthcare systems faced unprecedented strain, and economies around the world ground to a halt. The COVID-19 pandemic has exposed deep inequalities within and between countries, disproportionately impacting marginalized communities. It has also highlighted the importance of scientific research, public health infrastructure, and global cooperation in addressing global health challenges. As we navigate the ongoing pandemic, there is hope on the horizon. Vaccines have been developed and are being rolled out globally, offering a path towards immunity and a return to some semblance of normalcy. However, the pandemic has left an indelible mark on our world, reminding us of our shared vulnerability and the importance of collective action. Lessons from the past, hope for the future. Thanks for watching. If you found this video informative, don't forget to like, share, and subscribe for more content like this. Stay safe and take care. As we've journeyed through history, we've witnessed the devastating impact of pandemics on humanity. From the Black Death to COVID-19, these outbreaks have tested our resilience, challenged our understanding of the natural world, and reminded us of our interconnectedness. However, amidst the tragedy, we've also seen stories of human courage, compassion, and innovation. We've learned the importance of scientific research, public health infrastructure, and global cooperation in addressing these global health challenges. As we move forward, let us carry these lessons with us, working together to create a healthier and more resilient future for all.